Hi there, welcome back to Ask the Chiropractor, your source for health, healing, health-related information, and chiropractic. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're here with our guest today, Dr. David Flom, out of Sterling Heights, Michigan. Good to have you with us.
Good to be here. I'm glad you asked me.
Now, Doc, we usually start our show off by just talking to our guests about how they were inspired to get into their profession and why they were inspired to get into the profession.
I was in the restaurant business for 17 years, and I actually had back problems. And I used to, when this is the ultimate no-no, but I would sit in my office chair and I'd go all the way back and slam my feet on either side of the door, and my low back would go pop, and I felt really good. And what I didn't realize is that I was taking a bone that was loose already and making it looser and looser and looser instead of getting the one that I needed to move. And so I ultimately reached for a payroll drawer, touched it, and I was in pain, and then I was doubled over, and that's the way I was. And then I went to try pills, potions, and lotions to try to get myself back, and nothing worked, nothing worked, nothing worked. And finally someone said, "Hey, have you tried a chiropractor?" And so my friend, literally, I got back in the back end of my '79 Chevy, crawled, and he drove me to the chiropractic office. Well, after my adjustment, I was standing upright. And I thought, wow, this is unbelievable. Now, 15 minutes later, I was back down, but I thought, geez, if I had 15 minutes after 3 months of being in pain, 15 minutes pain-free, I knew that if I continued to do the chiropractic, that I would get better. And to this day, I have pain-free.
That's awesome. And even after that, before you went to chiropractic school, you were in industrial medicine for a while, is that correct?
That's correct. After I left the restaurant business, and I thought, geez, I was interested in either being a doctor of osteopathic, or I really had not entertained anything. I thought before I was 40 that I'd become a doctor. And then I went to undergrad, and the more undergrad I received, the more I decided that I would go to a nerve-based care versus blood-based care, and chiropractic was the only sensible thing to do.
And one thing I noticed you said there is after the first adjustment, you were upright, feeling great for 15 minutes. And there's some big misconceptions when people see a chiropractor, especially for the first time, about how they're expected to feel or respond after just the first adjustment. Now, a lot of times people may see a chiropractor and think that, you know, this worked just for a minute and this didn't work for me. It didn't fix me, it didn't cure me, it didn't heal me.
Right.
Or sometimes they'll think the opposite, where they'll go for just their very first adjustment, and we'll take a spine that's been degenerated, arthritic, and in the wrong position for 25 years, and the first time they'll be a little sore. And the misconception is that those people, we hear them say that, I went to a chiropractor and
I felt worse
and it didn't
afterwards.
work. Chiropractic didn't work for me. I don't believe in chiropractors.
I tell my patients all the time, there's 3 things that you can feel after a chiropractic adjustment: better, worse, or the same. Now, I would rather you feel better. Of course, that's what we're here for, to make people feel better. But I'd actually rather have the patient feel worse than feel the same. Because if you feel the same, I haven't affected a change. And that's what we're trying to do, is affect a change in your spine in order to make it necessary. And think about it. You have muscles, ligaments, and tendons that you're working with, and you're trying to break down scar tissue from years of abuse and years of things that's gone. And until you know, and here's the difference between when I say when you feel worse. If you feel worse because, let's put it this way, you work out, I can tell you work out. If you've had a real good workout and the next morning you wake up and go, oh, I haven't felt those muscles in a long time, is that a good sore or a bad sore?
That's a good sore.
That's a good sore.
That's a great sore.
So that's the kind of sore. If you feel worse, if you feel muscles and you go, oh, geez, I haven't used those muscles in a long time, that's because literally the nerve supply has come back to certain muscles that you didn't have before. Now, if it feels like a sharp stick is poking in your eye, okay, that's when you need to call the office.
And in the same regard, I say when someone says that, I went, I felt worse, it didn't work for me. It's like someone that's 800 pounds saying, well, I went to the gym once, and I'm still 800 pounds, and now I'm sore. It
Right.
made me worse. Gyms don't work for me. I don't believe in exercise. But of course, it's ridiculous. And that's why what you're talking about here, basically educating the public, educating the patients is so important as to what we do, why we do it, how this works, so that they can fully understand exactly how their body is going to respond and how their body works.
And how they function. One of the analogies I always use is when you have your hands clasped together, okay, and you have this, and then through repetitive injury of your job, you might be a roofer, you could be a typist, you know, the repetitive injury of typing, or depends on, you could be a fireman, a policeman, any profession that's out there that has a physical work and a repetitive physical work. When you lock your fingers like this, okay, I can have two guys on either side of me pull, and without any effort, I can hold this, and it's strong. That's a strong spine, strong muscles, strong ligaments, and strong tendons. But through repetitive injury, you know what happens. It breaks down, and it breaks down, and it breaks down, and it breaks down. And next thing you're like this. Well, how much effort does it take to pull like this? Boom! That's me reaching for a payroll drawer. Obviously, I had back problems well before that I reached for that payroll drawer. It wasn't the payroll drawer, that was the straw that broke the camel's back.
And that's unfortunately what we see most of the time when someone comes into our office and they're down on their haunches and they're limping in and they say they blew their back out. Mm-hmm. Most of the time in that situation, it is the straw that broke the camel's back. It's something that had been going on for years and years. And most of the time when we see people right off of the street, right off from the public, that haven't heard about chiropractors, don't understand what we do, it's people that should have been checked, should have had their spines checked years ago. Right. That's why it's so important to keep a healthy spine, to maintain a healthy spine, just like we brush our teeth.
You get your eyes
when our
checked.
Teeth aren't, exactly.
You get your teeth checked. How important would it be to check the nervous system? And obviously when we start adjusting somebody and they're here, we now start adjusting them and start adjusting them and start adjusting them to get this back to where it needs to be, to break down that scar tissue and rebuild back to permanently fix the problem versus just, you know, trying to fix the problem temporarily.
And there's a difference between patching it up and fixing it. And that's a difference in care plan, frequency, and treatment that the patients would receive at an office.
Absolutely. A lot of patients think that, you know, when you're going in for relief care and you go in, we can fix your, we can usually get somebody symptom free within 10 to 12 visits. The problem is, the problem usually isn't gone. The problem's been there for 10, 15 years, and problems that have been there for 10 or 15 years don't go away in an instant.
And usually what happens is that the physical manifestation that people feel is the last thing to show up in the disease process. The problem has been there years and years later, now a symptom arises. And then as we start to correct the problem, the symptom is the first thing to go away. So if people, again, don't understand exactly how their body is working, once the symptom goes away, they think they're all better, they think they're all fixed or cured. Meanwhile, their spine looks only just slightly better than it used to, but it's still wrenched out of position and still needs a lot of work before the problem is fixed.
Absolutely. I explain to my patients a lot of times the difference between a blood-based treatment and a nerve-based treatment. I decided that I was going to go into nerve-based versus blood-based treatment. You know that in a blood-based doctor, you go and he'll take your blood pressure, he takes the temperature of your blood, he will take a byproduct of your blood, fecal matter and urine, and test it. And if he really thinks you're in bad shape, he'll take and test your blood, and he finds out there's something wrong. So let's, for an example, in males, if you find the PSA, prostate serum antigen, if they find that in your blood, they know that your prostate has been malfunctioning for 10 to 20 years. And if they find something in the kidney, if they find the BUN, the urea nitrogen, then they know that your kidney has been malfunctioning for 10 to 20 years. And there's the difference. Everybody thinks, an example, the Dearborn police chief, 49 years old, he drops dead of a heart attack. His first symptom was the heart attack. Well, we know that he's been having heart issues. His heart issue didn't start 5 minutes before. His heart issue's been going on for how long? 10 to 20 years. And that's why when do you want to get your health checked? Do you want to get it checked after the fact, or do you want to get checked before the fact?
And even as great as our technology is, as early as our detection is, even with cancers and these type of things, most diseases, the average cancer has been there for 7 to 15 years before it's visible on an MRI, CT scan, palpable on X-ray or mammogram. It's been there for years before it's even just the size of a small pea or BB.
Absolutely, and that's why early detection or early detection for subluxation is important. To get your spine checked early. Now, I always say, you know, people always ask me, well, you've got a lot of children in your practice. Why in the world would a child need to be adjusted? You know, children right out of the box, brand new. Now, I adjusted my children when they were hours old because of birth trauma coming through the birth canal. And I actually delivered my 2 children. Okay, so that was very exciting for me. And then I checked their spines. Actually, what I did was I checked their nervous system. And they say, well, check their nervous system. Why would you do that? And here's the thing that a lot of people don't know. As soon as a baby's born, you do something called ABGAR, which is a nervous system check. Appearance, grimace, respiration. And these are the things that they check. And it's so important that 5 minutes later, they check it again. It's so important that 15 minutes later, they check it again. So they check that baby's nervous system right along. Now, as a chiropractor, you know that we've had 320 hours of neurology, and the average doctor has 112. Now, who would you rather have checking your baby? Someone with 320 hours or someone with 112 hours of neurology?
It's a lot of neurology.
Yeah, absolutely.
And another misconception is that most people think a chiropractor is dealing with, they know that we deal with the spine, but they think the spine is just there to hold them up. It's a support system to hold them up. Most people don't realize that the spine, its primary purpose is protection. It's there to protect our sensitive and delicate nervous system. And the nervous system's job is to control and communicate every function of the body and send messages back and forth from brain to organs, from brain to body. And that's why it's so important to keep this nervous system healthy even as a child, even right from birth.
Absolutely, especially when when children, on an average, have 2,500 spinal injuries by the time they're 12 years old, okay, according to the World Health Organization. Now, that's an amazing thing. You think, geez, how can somebody have 2,500 spinal injuries? And then I watch my kids play. And when you watch kids play and they're on the trampoline and they fall off the couch, they fall off the bed, they're bouncing down the steps, and then you look and you say, now I can see that.
First thing, they roll out of bed, they fall off the bed in the morning, boom, hurt their spine. Then they jump back into bed, kick their brother out, boom, there's 2 of them with the spine out of position, which we call subluxation. They're fighting, they're wrestling, they're falling off monkey bars, there's all sorts of things. And children can absorb a lot more of this damage than we could as an adult because their bones aren't fully formed yet and they're still cartilage, but they can absorb them all. And there's things that we do in society right now that some of these other countries, in like Western Europe, like the Armenians, people that live to 120 years old, that they don't do. Human beings aren't made to walk on concrete or sit as often as we do. Right? We don't stand upright. We're constantly on our cell phones with our spines out of position. We sleep in awkward positions. We're hunched over driving, watching television, typing on computers, things that our bodies weren't made to do, where some of these thousands of years ago, or these Armenians even now, they're living to 120 years old, they get up in the morning, they're standing up straight, they walk up the mountain, get a bucket of water, and walk down the mountain with their bucket of water. They're living with a natural position for their spine, obviously causing a lot less damage than we do here in the busy concrete jungle of America.
Absolutely. And a perfect example of children and why children need to be looked at in their spine is because we put them in school desks. And they sit in their school desks, right, and they're hunched over and they're writing for hours and hours and hours. You know, for 6 hours, they're over like this. And then that creates that forward anterior carriage. And then we give a kid a backpack. Now, it's an amazing thing about backpacks because you're only supposed to have 10 to 15 pounds per body weight, and you're supposed to strap that backpack on so that you carry the weight as close as body as possible. Well, you know, kids carry their backpack with one shoulder. And one book itself is all they could fit, but yet they have 4 and 5 books. When you see a child walking forward like this, and you know that if he stood upright, he'd fall over like this, you know that his backpack is too heavy.
We see 40-pound children carrying 25, 30-pound backpacks all the time. That's why it's very important as chiropractors, we do backpack safety workshops in the school districts. I go in and we do assemblies, we do in individual classes, we do for the PTAs, we do backpack safety because these children can really hurt themselves now where they don't even think it's a big deal. They don't even fret it once, even give it a second thought that they're carrying their backpack like this. But now, over time, just like we were saying, 10 to 15 years later, they're going to start to see the effects, of the problems of the damage on some of these nerves they may have caused. And the scary thing is, that doesn't necessarily mean pains or twinges in their back or their spine. Those particular nerves control particular organs in the body. We have 31 pairs of spinal nerves, and this is basically the body's fuse box. Every one of these fuses goes to a different room in the house, and our rooms in the house aren't rooms. They're our stomach, they're our liver, they're our pancreas, they're our spleen, they're our muscles, ligaments, and glands. And so what I ask people, I ask my patients all the time, if the power goes on in your house, all of a sudden the lights shut off, what's the first place you want to check?
Go to the fuse box.
You go to the fuse box. You're not going to run in the kitchen and change the light bulbs or plug in plugs again. You're going to go right to that little box, open it up, and check if any of these fuses are blown, turning off the power in that particular room or many rooms. And so this is exactly what this is in our body. The spine is our fuse box, and this is our power supply. Our brain is, we know, our total power supply. And believe it or not, the spine actually looks like a fuse box. You can see this here on the camera. These bones here, which we call spinous processes, actually look like fuses. And if any of these fuses are twisted off to the side, we can see what it's going to do to that nerve. We get a shot of that here. If any of these fuses are twisted out of place, we can see exactly what it's going to do to the nerve. So what we do as chiropractors is go through, check all the fuses, push the bone back into place, and what we say, turn the power on.
It's an amazing thing that when God created the spine and these things leading to our internal organs like this, you can see up here that there's more than one switch going to it. So you have 5 of these things coming from the back here going to the heart. That's why when you have one subluxation and it causes a 60% decrease in communication from the brain to the heart, your heart doesn't stop, okay? And then what ends up happening is this decreases, and then it causes what? The next one to decrease. Then it causes the next one. Now when you're at 60% of 3 of the bones, then all of a sudden your fuse box, when you have a 20 amp fuse and you put 21 volts in it, it pops. So now that's why somebody can be 49 and all of a sudden when their first symptom is have a heart attack and it doesn't appear that anything's wrong, because the silent killer, which is subluxation, comes in here and first gets one, then gets the next, then gets the next, and then you put too much strain on your heart and then suddenly the lights go out.
Let's go out. And the amount of pressure that it takes to reduce the function up to 60% is not that much. It's
the weight of a dime.
Exactly. It's just
the weight
of 10 millimeters of mercury of pressure. Just a very, very slight amount can reduce the function up to 60%. And that's what people don't realize, is that they think in order to see a chiropractor, they must have had a major spinal trauma. That it's just not the case.
Right.
The only way to know exactly what it looks like is to take a look at it. And that's why we do examinations. That's why we take x-rays. We have countless hours of training in this, and that's the only way to see what the functionality of the spine is. We do thermography, we do surface EMG. We have all sorts of different ways to find and locate subluxation or interference in the nervous system.
It's amazing when we were talking about the kids and we put them in desks, then we put backpacks on them, then they try sports and they're doing all sorts of sports things, and everybody forgets about impact injury. Okay, an impact injury is an injury that happens through an impact, and it's not necessarily something that you have to break a bone. So everybody forgets, they think that you have to break a bone or you have to be bleeding in order to be injured. And what people don't understand, for an example, if you're wearing a bulletproof vest, okay, and you get shot, well, you're not bleeding, but yet what happened? You're dead, because the impact hit your heart at such an impact it stopped your heart like that. And everybody thinks, because of TV, that if you're wearing a bulletproof vest, you're protected, okay? If you're in a vehicle, in a motor vehicle, and you're going 10 miles an hour, and you just get that little fender bender at 10 miles an hour, that's the same as having a 70-pound bag of sand hit you from a 2-story building. It's called impact injury. When you have the, I don't know if everybody's familiar with the little balls, and you hit it like this, and the other ball goes like this. If you take 2 and then 2, but those middle balls don't move, do they?
Not at all.
They sit right there. And you have these other things going bam, bam, bam. Well, you know that there is a force traveling through that. Well, when you're in playing football and somebody gets popped real good, okay? Or if you're in a vehicle and you just get that very small bang, okay? You think, oh, geez, I'm not bleeding, I didn't break a bone, but nothing happened. And that yet years later, all of a sudden you wonder why you have the background. Those are those mini traumas we're talking about, why everybody downplays a small accident or downplays playing football or injuries like that. Now you know that in between 16 and 26, that 97% of everybody gets into a motor vehicle accident. That's why you can't rent a car until you're 26 years old, because everybody, the likelihood of you getting in an accident happens. So we're traumatically, we're doing things that are trauma to the body. We get in a car accident, and then what happens? Now we're 26 years old, and growth hormone stops in our body, okay? You're 26, and growth hormone is something that allows us to go through puberty, allows us to grow into adulthood, why we get bigger and bigger as we go, and after 26, it stops. That's why somewhere in between 26, now I'm 50 years old, I don't think you're...
Not quite that old.
Not quite old, okay. In between 26 and 30, you wake up and what's the name of the truck that hit me? Okay, I used to always play hockey, and now all of a sudden when I got up, I'm sore. I used to always run, and now I wake up, I'm sore. And those people out there in the audience that are in between the age of 26 and 30, and they wake up and they're sore and they're wondering what's going on, it's because they've had this life of small mini traumas that suddenly, you know, because we get patients all the time, they can't explain, they just woke up with it. I woke up this morning and I'm in tremendous pain. Couldn't even get out of bed.
And the saddest thing that we see is, I see people all the time that they had a car accident or a whiplash trauma, or they fell off of a horse or something like that. And they didn't even think twice about it. They said they were sore just for a couple of days, and then the soreness went away. Now here it is 10 years later, 15 years later. Now they have all sorts of different health problems, and they have asthmas, and they have allergies, and they get chronic migraines, terrible migraines, and all sorts of different health problems that come up that started and stemmed right from that car accident that they thought was no big deal, was 10 miles an hour. And what it's like a duck sitting on a pond. After that car accident, you know, a couple days later, on the surface, everything is cool. The duck is just sitting on the pond. But you look below the water and those little legs are just kicking. You look inside and there's now trauma happening, building up dis-ease in the body. A system of dis-ease. It's not regenerating normally. Our cells are constantly being replaced. Right? Every one of our cells, almost next year, almost every cell in our body will be completely different. Our stomach lining, the whole thing is replaced in 10 minutes. Our lung cells, 6 months, we'll have new cells.
Every 30 days.
Yeah, red blood cells every 30 days, heart cells every 90 days, constantly being replaced. Now, if there's dis-ease and dysfunction going on in the body, we're not able to send the correct message from the brain to the rest of the body to tell it what cells, what quantity, what type of cells, where to replace these cells, and we're replacing with abnormal, unhealthy cells. And over time, years and years later, that's disease.
Right.
Rather than dis-ease, a system of not ease, now it's what they call disease.
Right. Right. It's amazing that we have a genetic blueprint, and you know that 23 chromosomes and 23 chromosomes, then you get somebody, and you have your genes. Your genes is your blueprint. It's your blueprint of your entire body. Now, if we took a blueprint, we had 2 separate houses. We're going to build 2 separate houses. This blueprint, this house, we're going to use all the best materials. We're going to use quality lumber, best pipes, everything that we can use. The best copper, the best shingles, the best paint, everything. And this house over here, we're going to use the cheapest stuff. Anything we can find, dig up. It doesn't matter whether the 2x4s are straight, whether the paint's watered down, it doesn't matter. Both of them the same. Are they the same house?
It was the same blueprint, but obviously they're a different house. Obviously one is going to hold up a lot longer and a lot better than the other one.
So your genes never change, but the expression of your gene changes depending on how you build your house. That's why important, very important, to eat well, move well, and think well.
Because believe it or not, everybody has some bad genes. Everybody has somewhere in their family history some history of cancer or diabetes or something. And so, like you said, the problem is not your genes, it's how you end up expressing your genes. So by doing things like eating well, moving well, and thinking well, eating the right foods, giving your body the right nutrients to grow and develop properly, keeping your spine in its proper place, keeping any pressure off the nervous system so that it can function and heal at an optimal level, not only does that prevent us from expressing some of these bad genes and having this house that could more easily fall apart, it actually increases our overall performance. And that's what people don't realize about chiropractic, is that not only do chiropractors see people that have a physical ailment or health problem, we see people that are what they would say is healthy people and increase their level of performance. That's why we deal with a lot of athletes. And most professional athletes now have their own chiropractor because
Absolutely.
it will increase their level of performance. They'll be able to get more oxygen into their body through their lungs. Their breathing will be just that much better.
Well, it's an amazing thing, and because I have a few medical professionals as patients, and I always challenge them. I say to them, do you understand that there's only 3 things on the whole planet that make you ill? 3 things and 3 things only: thoughts, toxins, and trauma. Either too much or not enough of those 3 things. And I'll have people go, thoughts? Well, how can thoughts affect your health? Go through a divorce, lose a loved one. Do you think your health goes up or down?
And that's what they say. People say, oh, stress is killing me. Well, it does. Stress does kill you because every thought you produce produces physiological chemicals in the body. And these chemicals are toxins. So basically, by thinking certain thoughts, you can be poisoning your body. Or by thinking certain other thoughts, positive, great, influential thoughts, you can then be feeding your body with proper chemistry, that
Absolutely.
helps you.
Proper motivation, you know, when you're doing a daily affirmation. These things really do help the chemical brain and the brain chemicals release properly for health.
What's crazy now is modern science, quantum physics, is proving some of these things that motivational speakers have said thousands of years ago. People like Aristotle, Plato had said these things thousands of years ago, and they're now proving it physiologically and scientifically.
And when we're looking at toxins, you know, people say toxins, you know, there's bad toxins. Well, obviously everyone's heard of water pollution, air pollution. Look at, we have 50,000 food additives in our food right now, and we only know 20,000 of what they even affect the body. So there are really a lot of toxins out there. I always tell my patients, the closer to earth you can eat, the better. If it's made by God, it's good. If it's made by man, spit it out.
We'll have to continue that thought at next week at our next episode. We're talking about nutrition. We're talking about foods made by the earth. But we're just about out of time. Thank you so much, Doctor, for joining us. And remember that God gave us the gift of life, and what we do with that life is our gift back to God. Thank you for joining us on Ask a Chiropractor. I'm Dr. Adam Rodnick, and we'll see you next time.